You know that feeling? We bring home a new puppy all excited, or maybe you've seen some weird wildlife behavior nearby.
Yeah.
Well, today we're diving into something that impacts a lot of those animals, specifically in the carnivore order, canine distemper.
And it's really important to grasp that this isn't just a dog thing. It goes way beyond that.
Absolutely. So for this deep dive, we've got some pretty detailed stuff. Excerpts from a big medical overview. We're just calling it pasted text.
Okay.
And our goal really is to pull out the absolute must-know info for you. What canine distemper actually is, how it moves around, what it does to an animal.
And crucially, what we can actually do about it.
Exactly. We want to give you the core knowledge, but, without drowning you in technical terms.
Right. So let's start at the beginning. What exactly is canine distemper? How would we define it?
Okay, so the text describes it as contagious, often involving a fever, and it can be acute, like really fast, or subacute, sort of slower, and often, sadly, fatal.
A nasty.
A really nasty bug. And it hits a lot of systems. Think respiratory problems, urogenital tract issues, gut problems, eyes, and even the central nervous system. It's like everywhere.
A truly multisystemic illness. And the culprit behind it all is the canine distemper virus, CDV. But what's maybe quite interesting is its family tree, so to speak.
Yeah, this part really stood out to me. It's a morbillivirus, and that means it's related to human measles and also rinderpest in cattle.
Which is significant.
Hugely significant. So understanding this one virus, CDV, it doesn't just help with pets and wildlife. It actually gives us clues about this whole family of related viruses.
And the range of animals that can actually get this is, well, it's pretty broad, isn't it?
It really is. The source makes a point of mentioning lots of species in the carnivora order. Obviously dogs, but also, raccoons, skunks, foxes.
The ferrets too, right?
Ferrets, yeah, and even big cats in zoos, apparently. But it also notes that how bad the disease gets can really vary a lot between different species.
Okay, so how does it actually, jump from one animal to another, and then what happens once it gets inside?
Well, the main route is through the air. Airborne particles, droplets from coughing or sneezing.
Makes it pretty easy to catch them.
Unfortunately, yes.
Yeah.
Super transmissible. So once an animal breathes it in, usually the virus gets into these immune cells, macrophages.
Kind of like hopping a ride.
Exactly, like hopping a ride to the nearest lymph nodes. And that's where it starts making copies of itself. That's the initial replication site.
And it doesn't just stay put in those lymph nodes, I assume?
No, definitely not. Pretty quickly, maybe within a week or so, the animal starts shedding the virus, mostly in respiratory gunk, but also in urine.
Oh, urine too.
Yeah, and it begins spreading through the whole body. It hits basically all the lymphatic tissues, key immune system parts. Then it jumps into the bloodstream.
Like a highway system.
Right, using the blood to get to the surface layers of the respiratory tract, the gut, the urogenital system, and critically, it can cross into the brain and spinal cord.
The text mentions 2 phases of fever early on, and also lymphopenia. Why are those significant?
Well, that first fever spike, it might be quick, easily missed. And the lymphopenia, that's a drop in lymphocytes, a type of white blood cell.
The immune fighters.
The main fighters, yeah. So that dip means the immune system is taking an early hit. These can be the very first signs, but they're subtle. How things go from there really boils down to the animal's own immune system.
It's like a battle inside then.
Totally, a strong immune response. The animal might fight it off without even showing clear signs. That's subclinical.
Okay.
A weaker response might mean a subacute infection. The animal is sick longer, it's kind of a slower burn, but they might survive longer. But if the immune system just fails,
Then it's bad news.
yeah, then you see severe, rapid disease, often leading to death in just, say, 2 to 4 weeks. Frequently because the nervous system gets hit hard. Seizures, things like that.
And how long does an infected animal keep shedding the virus, potentially infecting others?
The source says it can be up to 2 or 3 months, but usually it's shorter than that, so that's something at least.
Right. So if you suspect an animal might have distemper, what are the sort of classic signs you should be looking for?
Okay, so after that possible first fever blip, you might see a second fever, one that maybe comes and goes, plus discharge from the nose and eyes, runny nose, goopy eyes.
Like a bad cold, initially?
Kind of, yeah. But then also lethargy, loss of appetite, and then often gastrointestinal stuff, vomiting, diarrhea, and respiratory signs like coughing. And these often get worse because secondary bacterial infections jump in.
Because the immune system is weakened by the virus.
Exactly. Those bacteria take advantage.
And the central nervous system involvement, the CNS stuff, That's a really big worry with distemper, isn't it?
Oh, absolutely. It's a major feature. The text breaks down into sort of two patterns, gray matter disease and white matter disease.
Okay, what's the difference there?
So, gray matter disease tends to affect the brain's surface, the brainstem, spinal cord. It can cause things like meningitis inflammation around the brain seizures, acting really out of it, stupor, even weird behavior like hysteria, and trouble coordinating movements, ataxia.
That sounds severe. Can they recover from that?
Some might recover from that stage and actually develop immunity, but others, unfortunately, will progress to the white matter disease phase.
And what does white matter disease look like?
That one's described as more variable. Signs can pop up in different spots, multifocal, but common things are problems with balance and coordination, weakness from spinal cord issues, an unsteady walk, and sometimes these involuntary muscle twitches or spasms, myoclonus.
Myoclonus, right, and the outcome there.
Again, it's variable, could be fatal, or they might recover, sometimes with just minimal leftover damage.
Are there any other, maybe less common signs people should know about?
Yeah, a few others are mentioned. Optic neuritis, inflammation of the optic nerve, retinal lesions, changes in the back of the eye.
So eye problems too.
Eye problems, yeah. And sometimes, though less often, a specific sign is hardening of the foot pads in the nose. Hyperkeratosis, they call it.
Hyperkeratosis, got it.
Oh, and one really common long-term consequence if a puppy gets infected very young is enamel hypoplasia. Basically, their adult teeth don't develop properly. The enamel is affected.
Ah, okay. So with this huge range of symptoms, how do vets actually pin down a diagnosis? How do they tell it apart from other diseases?
Well, often it starts with clinical suspicion. A vet sees a young dog, maybe unvaccinated, showing several of these signs affecting different body systems. Distemper jumps to mind.
But it could be other things.
Exactly. And the list of other things, the differential diagnoses, it's pretty long. For the cough and respiratory signs, you have to think about kennel cough complex.
Right.
For the vomiting and diarrhea, could it be parvo, coronavirus, parasites, bacterial enteritis, even swallowing a toxin or having something like IBD?
Okay, that's a lot just for the gut signs. What about the neurological ones?
For the CNS signs, yeah, the list includes autoimmune diseases, certain protozoal infections like toxoplasmosis or neosporosis, fungal infections, even tick-borne rickettsial diseases. It can be a real puzzle to sort out.
So what about lab tests? Can they help confirm it?
That they can offer clues. That early drop in lymphocytes, the lymphopenia, that's a potential indicator. Sometimes, under microscope, they can see these things called inclusion bodies inside blood cells. They're like little pockets where the virus is assembling.
Viral factories?
Kind of, yeah.
Yeah.
But standard antibody tests, they're tricky. A positive result could just mean the animal was vaccinated, or it could be the current infection. Plus, an animal might die before it even makes enough antibodies to detect.
Timing is everything.
Right. And even the IgM antibody response, which usually indicates a recent infection, can apparently pop up after vaccination or infection, so not always clear-cut.
Okay, so standard tests have limits. Are there more specific diagnostic tools?
Yes, definitely. They can test the cerebrospinal fluid, the CSF, for CDV antibodies. Finding them there strongly suggests infection within the nervous system, but it's not 100% definitive on its own.
What about imaging?
Imaging helps too. Chest x-rays, radiographs can show pneumonia if it's developed, and MRI scans of the brain can sometimes reveal areas of demyelination.
Damage to the nerve coverings.
Exactly. That damage caused by the virus or the inflammation leading to those neurological problems. And then there are tests that directly look for the virus itself.
Like PCR.
Like RT-PCR, yeah. That can detect the virus's genetic material in samples like blood, specifically the buffy coat layer, urine, CSF, even swabs from the eye or nose. There are also tests like immunohistochemistry or antigen tests on tissues.
And after death.
Postmortem, yes, examining tissues is really important for confirmation. Lungs, stomach, bladder, lymph nodes, and especially the brain are key tissues to look at.
Okay, so let's say an animal is diagnosed. What can actually be done? What are the treatments?
Well, the tough news first. There's no specific drug that kills the canine distemper virus directly. No magic bullet antiviral.
So treatment is more about support.
Exactly. It's all about supportive care and managing the symptoms as they pop up.
And the text really stresses isolating the animal. Why is that so critical?
Because it's just so contagious. You absolutely have to keep infected animals separate, ideally in a proper vet hospital isolation unit to stop it from spreading to others.
Makes sense. And it also mentioned that neurological signs are often irreversible.
Yeah, that's another hard truth. Once significant neurological damage has occurred, it's often permanent.
So what does that supportive care look like in practice?
It involves things like IV fluids if they're dehydrated or not eating, keeping their eyes and nose clean from discharge, making them more comfortable. And a big part is treating those secondary bacterial infections we talked about.
With antibiotics?
Yes, using broad-spectrum antibiotics. The text mentions things like ampicillin, tetracycline, chloramphenicol to fight off bacteria that take hold because the immune system is compromised by the virus.
What about controlling symptoms like seizures?
If seizures are happening, yes, anticonvulsant drugs are used. Phenobarbital or potassium bromide are common choices to try and manage them.
Now, the text also cautioned about using corticosteroids, right?
It did. Generally, they're avoided or used very cautiously. While a very low dose might be considered briefly for anti-inflammatory effects, higher doses are usually a no-go because they suppress the immune system even further.
Which you don't want when fighting a virus.
Exactly. Could make the viral infection worse. There's also a specific warning about using tetracycline and some other antibiotics in very young, growing animals because they can affect teeth and bone development.
Good to know. So ongoing monitoring is key then.
Absolutely crucial. Watching closely for any worsening neurological signs, checking for pneumonia developing, making sure they stay hydrated. It's intensive nursing care.
Okay, that covers treatment. What about the best approach to prevention?
Yes. And the message here is loud and clear from the source. Vaccination. That is the absolute cornerstone of preventing canine distemper.
It's the most effective tool we have.
By far.
So what kinds of vaccines are out there?
There are a few main types. Modified live virus vaccines, MLVs, are generally considered very effective.
Okay.
Within the MLVs, there are ones grown in canine tissue culture, like the Rockborn strain. They tend to give a really strong immune response. But there's a very, very small risk, especially in maybe susceptible animals, of causing a type of brain inflammation after vaccination. It's rare, but it's documented.
A potential downside? What's the alternative MLV?
The other main type is grown in chick embryos, like the Lidural strain. These are seen as safer, no reported risk of that post-vaccine encephalitis. The trade-off might be a slightly less robust immune response in some individuals compared to the Rockborn type.
Interesting. And you mentioned wildlife risks.
Yeah, the text specifically notes that the Rockborn type MLV can actually be dangerous and cause disease in certain wild carnivores, so it's not suitable for them.
Okay. Are there options besides the modified live ones?
Yes. There are killed virus vaccines. These don't replicate in the animal, so they're generally safer, especially for species where MLVs are known to be risky. The text mentions red pandas and black-footed ferrets as examples.
Safer, but maybe less potent immunity.
Potentially, yeah. Often requires more boosters. There's also a recombinant vaccine technology using canarypox virus as a carrier for the distemper antigens.
Lots of options. How long does the protection usually last?
The good news is, for most of the common vaccines used in dogs, the duration of immunity is pretty long, often well over 3 years.
That's good. What about puppies? When do they get vaccinated? This is always a question.
It is, and it's complicated by maternal antibodies, the protection puppies get from their mom's milk.
Right, those antibodies can interfere with the vaccine working properly.
Exactly. That protection from mom usually fades between about 6 and 12 weeks of age. So because you don't know exactly when an individual puppy loses that protection, the standard approach is a series of vaccinations starting around 6 to 8 weeks old and repeating every few weeks until they're maybe 16 weeks or older.
To catch that window when the maternal antibodies are low enough, but before they're exposed.
Precisely. There's also mention of using a measles vaccine in very young pups, like 4-6 weeks old. It's called heterotypic vaccination. It doesn't stop them from getting infected with distemper later, but it can offer some protection against actually developing the disease, especially while maternal antibodies might still be blocking the distemper vaccine itself.
That's interesting. And one last point on this. If a dog recovers, are they a carrier?
No, the text is clear on that. Dogs that fully recover from canine distemper do not continue to shed the virus or act as carriers. Once they're better, they're clear.
That's reassuring. So, thinking about the overall picture, the prognosis, what's the typical outcome or expected course for an animal with distemper?
Well, as we've sort of touched on, it's really variable. It can be anything from subclinical, no obvious signs, all the way to acute and fatal. Or it could be subacute, lingering longer.
Right.
A key point is that neurological signs can sometimes show up late even after the animals seem to be getting better from the initial respiratory or GI signs, weeks or even months later.
That must be devastating for owners.
Absolutely. Now, some mild neurological signs might improve over time with supportive care, but those muscle spasms, the myoclonus, if they develop, they often persist long term, even if the animal otherwise recovers.
And the overall survival rate?
The source puts the approximate mortality rate around 50%, so it's serious, roughly a coin toss. And death, if it occurs, usually happens somewhere between 2 weeks and 3 months after getting sick.
And given the severity, especially with the neurological signs.
Yes, sadly, euthanasia is something that often has to be considered, particularly if an animal develops severe, uncontrollable seizures or the neurological damage leads to a very poor quality of life.
A difficult decision.
Extremely. But again, to end on a slightly more positive note for survivors, fully recovered animals are not shedding the virus.
Okay, so let's try and wrap this up. To bring our deep dive to a close, what are the main takeaways?
I think the big things are canine distemper is it's a really serious, complex virus. It doesn't just hit one part of the body, it's multisystemic. And it affects way more than just dogs. Lots of different carnivores are susceptible.
And vaccination is absolutely critical for prevention. It's the best tool we have.
Definitely. And the outcome, how severe it gets, it depends on a lot of things. The specific virus strain, the animal's age, its overall health, and crucially, its immune response.
Right. Hopefully going through all this detail has given you, our listener, a much clearer picture of what canine distemper involves, its complexities, the challenges in diagnosis and treatment.
Yeah, we hope so. And maybe just one final thought to leave you with, something to chew on. Given that really close family tie between canine distemper virus and other viruses like measles, what could we learn from studying one that might help us fight the others? Across different species, maybe even informing human medicine.
That's a fascinating question, the interconnectedness of it all.
Exactly. Something to think about.